risk factors. And
Mm-hmm.
these risk factors, we basically, from cardiologist point of view, or from any perspective, basically we classify them in modifiable and non-modifiable risk factors. So non-modifiable risk factors are like age, sex, like males are more basically prone to develop heart problem at an early age as compared to females. Then ethnicity, race. So these are the some factors which cannot be modified. So it is not in our hands. But then comes the modifiable factors, which are something to talk about, because these are the factors. If we are able to control those factors, then we can to a greater extent reduce the burden of basically the heart problem. And in these, apart from, like, we know about high blood pressure, we know about diabetes, we know about obesity, means overweight, then smoking, then lack of physical activity. Among all these factors, the most important, one of the most important factor is the cholesterol. So the cholesterol is basically something which is essential for our body. So it cannot be considered like that ये हमेशा ही खराब है. So भगवान ने ये बॉडी में दिया है, तो इसके बहुत इंपॉर्टेंट फंक्शंस भी हैं बॉडी के सेल्स को डेवलप करने के लिए, एक पर्टिकुलर एनर्जी प्रोवाइड करने के लिए. So this is something not like a vestigial, we say, na, like the appendix or in our body part, which is a vestigial organ, which is not basically of any use. So cholesterol cannot be considered that. But to a certain extent, when because of our lifestyle, because of some genetic factors, when its level beyond certain level starts increasing, then it starts creating problem. So we can classify this cholesterol into two categories, the broad categories, which is the good cholesterol and the bad cholesterol. Because most of the time people in my clinic also ask me which is the bad cholesterol, which is the good cholesterol. So one thing to start with, basically, I'm not just basically concentrating on my topic just on total cholesterol, because most of the time when I ask the patient to get the cholesterol test done, so they just come up with only the cholesterol, means the total cholesterol. But we should know that cholesterol contains many other cholesterol within it. So apart from the total cholesterol, there are LDL cholesterol, there are VLDL cholesterol, there are triglyceride, there are HDL cholesterol. So these are the types of the cholesterol, and every cholesterol has got its significance and the label, and according to which there are certain treatment for each and every cholesterol, and each cholesterol is having some or other form of basically the risk associated with it. So then we classify the cholesterol into the good and bad cholesterol. So except for the one cholesterol like HDL cholesterol, all are the bad cholesterol. So like total cholesterol, LDL cholesterol, VLDL cholesterol, triglyceride cholesterol. So these are all the bad cholesterol. So it is only the HDL cholesterol which is a good cholesterol. So so good cholesterol is one, and we are fighting against 4 bad cholesterol. So you can see there is a one soldier and 4 enemies. Okay.
Oh, wow. Okay.
So this is something to worry about. So our defense mechanism is weak, and therefore we should be very vigilant in maintaining our cholesterol levels. So there are certain values of the cholesterol in which limit the cholesterol is not injurious, but over a period of time, when the cholesterol starts rising, then they gets depositing in each and every basically blood vessels of the body. More predominantly basically in the vessels of the heart, which we call as coronary arteries, then in the vessels of the brain, carotid arteries, then in the vessels of the basically the lower limbs, which we call the peripheral arterial disease. So these are the.
Sorry to interrupt. We had a related question. Mr. J.N. Pandey had asked
just based on what you said just now is why I've interrupted you. That he asked, ज़्यादा cholesterol arteries में deposit होता है, जिससे blockage develop होता है. So is this true that it's because of the cholesterol that deposits that causes heart blockage?
Yeah, I'm coming to it because you know that the process of plaque formation inside our arteries, whichever it is arteries, whether it is the heart arteries or the brain arteries or the hand arteries or the leg arteries, or wherever the blood vessels are there. So the process of plaque formation develops as early as 12 years of age.
Oh my God.
So you can see that the plaque formation is starting very early, and it is independent of the risk factors, because at 12 years you can understand the patient, the people might not be having blood pressure, they might not be having diabetes, or in some patients they might even not have any positive family history or genetic preponderance, but still that the plaque formation is occurring. So that means some sort of atherosclerosis, which we call as plaque formation, atherosclerosis. It starts as early as 12 years of age.
Okay.
And gradually this plaque formation builds up. And the basically the factors which helps in this plaque progressions are basically these risk factors like hypertension, diabetes, smoking, and cholesterol is one of the important factor in the plaque progression. So the person who has like in today's life we are seeing the very young children, the population is developing high cholesterol level. So you can imagine that this high cholesterol is going to develop means deposited inside the arteries at a much younger age, and over a period of time it may lead to gradual narrowing of the arteries, and gradual narrowing of arteries can suddenly then gets 100% blocked and can cause heart attack or can cause stroke, paralysis. So Dr. Joel was basically true in the sense that it is basically not only there are certain other factors which are getting deposited in the plaque, but the cholesterol is one of the most important constituent in that plaque formation. And the cholesterol rich जो plaques होते हैं वो काफी vulnerable होते हैं. Vulnerable means unstable plaques होते हैं. तो अगर हम जैसे पेशेंट का एंजियोग्राफी करते हैं और एंजियोग्राफी में कोई हमें डिजीज नहीं मिलती, मींस दे आर जस्ट 30-40% स्टेनोसिस, not significant like 70% or 80%, it is just 30-40%. But उस प्लाक में अगर कुछ हेजीनेस होती है, मतलब कुछ वाइटिशनेस होती है, तो इस तरह के जो प्लाक्स होते हैं वो अनस्टेबल प्लाक्स होते हैं. अनस्टेबल प्लाक का मतलब होता है कि ये प्लाक कभी भी रप्चर हो सकते हैं, और ये रप्चर होने के बाद वहां पे एकदम क्लॉट बन जाता है और सडनली पेशेंट को हार्ट अटैक हो जाता है.
अच्छा.
तो इसीलिए इन प्लाक्स की इंपॉर्टेंस ज्यादा है as compared to those plaques which are very significant like 70% or 80%, because we know that there is a disease, but these are the plaques in which we don't treat our patients well because we have a very less understanding. कि 30-40% है, patient also will not be ready to take the treatment, and doctor also not basically much familiar that such kind of plaque needs to be treated more aggressively as compared to the other treatment. So this is something very important in this regard.
And doctor, you mentioned that it's happening more and more in younger patients nowadays, as early as 12 years old. Is this because of genetics, or is it more to do with like sedentary lifestyle and the way that the world is changing now? Everyone I think most kids now are sitting at home rather than playing outside. Maybe are some of the reasons?
I would basically emphasize on the second which you have mentioned about the lifestyle part actually, because most of the time they are not genetically predisposed. Genetic may be just one of the constraints, because genetic also comes to play a role only when there are some environmental factors, acquired factors. Genetic alone can cause basically make the patient prone to develop heart attack unless until there are some additive factors, and those added factors are basically the environmental factors. So in which so younger age basically is getting more, because you are right. Most of the time it is sedentary lifestyle, junk foods, lack of physical activity, and lot of stress, because most of the time in the present time I have seen that mostly the 30 to 40 years of age developing heart attack. When they had come to my basically hospital and they got the angiography, found to have a artery which is 100% blocked, and they were totally teetotalers with no risk factors. So that means that the factor which is most important in the today's time is the stress. So excessive stress, whether it is a physical stress, whether it is a mental stress, it is taking the toll, in which the heart problem, the brain problem, and other problems, kidney problems are basically going on increasing. So stress is also one of the reasons why the younger people are getting more and more affected. And stress is something which affects entire age group. It is not something like that it is the elderly age group. Initially we used to listen from our parents that हार्ट की प्रॉब्लम तो 40-50 साल के ऊपर होती है, अभी तो हम 40-30 के हैं, अभी तो हमें कोई प्रॉब्लम नहीं हो सकती. Now actually that has been in the today's time it is not true, and basically it starts from very early age, and therefore we should prevent our younger population to developing from developing such a kind of heart problem or a brain problem, stroke problem, so that they continue to have a good lifestyle.
तो आपने अभी prevention mention किया है doctor, that you should talk to the younger generation. तो Mr. Om Prakash actually had a question कि is it possible to somehow increase HDL या good cholesterol in the body, और वो possible कैसे?
See, I'm coming on to this. So basically, we have understood about the 4 types of cholesterol, and one is the good cholesterol. So we should know about the label, and we should know about the guidelines that till how we should target, till how much level we should target the cholesterol. So total cholesterol in Indian population should be somewhere between 150 to 175. Although in different labs, because now the lab persons are giving the reference values on the right hand side, and they're putting the test values on in between. So person basically immediately come to know what is my cholesterol levels, whether it is high, it is low, it is normal. So, but it varies from lab to lab also. But if according to the guidelines, particularly in Indian scenario, the total cholesterol should be around 150, not more than that. Then LDL cholesterol is actually a big enemy of heart. So LDL cholesterol is a big enemy, and therefore guidelines have basically come up and categorize various patients in various categories, like low risk, then moderate risk, then high risk, then very high risk, then very high risk. So low risk, having no risk factors, LDL cholesterol should be less than 116. Initially it used to be less than 160, 160. But now, since they have come to know that even these values of cholesterol are also very harmful, and therefore now they have come up with the guidelines that even a person totally asymptomatic and no risk factors comes in the low risk category, and in this also he should have a LDL cholesterol of less than 116.
Okay.
And then as the basically the risk factors increases, like patients have diabetes, hypertension, then their LDL should be less than 100. Then if that patient has a heart attack or previous history of heart attack or previous history of stroke, then such patient should have LDL of less than 80. And if he has more than two attacks or 2 strokes, then should be less than 50. So anywhere nowadays they are targeting of LDL of even up to 20 to 30 milligram per deciliter. You can imagine. So how low they are targeted? Because every level of cholesterol is causing problem.
Okay, तो ये scientific studies की वजह से है that they are lowering level.
Yeah, ये Western guidelines भी हैं, plus Indian guidelines भी हैं, which we everybody can refer, Lipid Association of India. So for Indian population, basically they had come up with a different guideline because we know that our body habitus is quite different from the Western population, and our risk factors are also, because you will be amazed to listen that South Asians are prone to develop coronary artery disease almost 10 years earlier than the Western population.
Oh my goodness.
So you can see. So this is something very alarming, and that's why they have come up with their Indian guidelines, in which they had mentioned that anywhere LDL cholesterol in a high risk patient should be targeting less than 50 milligram per deciliter.
Okay.
Then coming on to the triglyceride, this should be less than 150 milligram per deciliter. And then comes basically the good cholesterol. Good cholesterol is basically the upper limit for males is 40, so it should be maintained above 40. Anything above 40 is very good, and for females it is more than 50.
More than 50.
Yeah. So these are the normal levels, and we know that LDL, I told you, it is the big enemy of the heart, should be targeted very aggressively. Then triglycerides are something which is very much linked to diabetes. So the person who are diabetics, they are always found to have high triglyceride levels, and therefore for triglyceride there are certain medications which we can give, but if they are able to control their diabetes, so we can to the greater extent, even without the medication, we can basically bring down the triglyceride levels. Then coming,
sorry to interrupt, doctor. आपके यहाँ पे दो questions हैं. First is from Mr. Rajesh Ranjan. He's asking कि role of CT calcium score for higher LDL cholesterol, and when we need to go for angiography for CT scan, preventative checkup के लिए.
It's a very, very, very good question. So see, the calcium score is one of the important tool in the present time, because it is by this we can basically assess the risk even when the patient do not undergo angiography. So if the calcium score is somewhere more than 200 or 300, that means that person might be having a significant plaque burden, because calcium start depositing in the areas where there is a plaque formation to a greater extent. So calcium is an indirect indicator of the plaque burden, and therefore greater is the calcium score, more is the plaque burden. So calcium score is a very good screening tool, so that we can assess that such a person should go further tests in form of coronary angiogram, whether it is a CT coronary angiogram or the conventional coronary angiogram. And then CT coronary angiogram is now coming a very important non-invasive diagnostic modality, because now most of the persons, they are interested in non-invasive, because I do angiography which is invasive, because that person needs to go into the cath lab. It requires basically admission, and CT coronary angiography can be done as an OPD procedure, and it is a non-invasive procedure. So from CT coronary angiogram, as I was telling you earlier, that we can know about the unstable plaques. So that can tell about what type of plaque it is, plaque morphology, whether it is calcified plaque, it is fibrous plaque, it is cholesterol-rich plaque. So cholesterol-rich plaque will tell us that plaque is unstable, and therefore such plaque should be treated very aggressively. So CT coronary, and regarding the time when it should be done, then it should be basically individual approach depending on the person's risk factors. So if the person is having very strong family history of heart disease, genetic problem, then person is having multiple risk factors like blood pressure, diabetes, dyslipidemia, then instead of going through certain tests prior to angiography, which most of the people do, like echocardiography or TMT. Because in the today's time, what I found is basically that person most of the time has found to be a normal echo, and patients basically most of the time argue with me कि echo तो सर normal है, फिर मुझे तो कोई problem ही नहीं है. So I basically explain my patient that echo comes out to be abnormal only at the time when the patient is having heart attack.
अच्छा.
So echo will only be abnormal in that scenario, or the person is having prior some heart problem and has suffered some minor heart attack. That echo will be abnormal, but most of the time, rest of the time, the echo will be normal. So it is something very misnomer that echo is normal, so I don't need any further test. So whenever the index of suspicion is very high or even intermediate, then even with a normal echo, one should undergo the further test, and for that the CT coronary angiogram is very good. And in an asymptomatic individual, just for screening purpose also, after 40 years of age, we recommend that cardiac screening should be done in every patient after 40 years of age. And if clinical suspicion like calcium score is high, then that person should also undergo CT coronary.
अच्छा. और डॉक्टर वी हैव गॉट 4 क्वेश्चंस अभी जो ट्रीटमेंट और मेडिकेशन से रिलेटेड है. तो आई विल टेल यू ऑल 4 क्वेश्चंस. क्वेश्चन 1 है कौन सा मेडिसिन HDL लेवल को इंक्रीज करते हैं. दैट इज क्वेश्चन 1. सेकंड क्वेश्चन इज बैड कोलेस्ट्रॉल. क्या हम बैड कोलेस्ट्रॉल फूड और डाइट के साथ मैनेज कर सकते हैं. तीसरा क्वेश्चन इज व्हाट काइंड ऑफ फ्रूट is good for managing bad cholesterol. Or the fourth question similar to what the previous question was कि अगर हम ज़्यादा calcium intake करते हैं, does that also increase your calcium score? So I can it's mainly medicine or diet के बारे में questions.
Yeah. So regarding your first question about the HDL cholesterol, see the HDL cholesterol. Initially there used to be medication for HDL cholesterol as well, but it used to have various side effects, so it was withdrawn actually. So nowadays for HDL cholesterol, what is the best treatment is to do a good amount of physical activity. So that is something the only way by which we can increase the HDL cholesterol. And to some certain extent, basically there are some medications which we usually give to reduce the bad cholesterol, which are like statins, and